Hi, thank you for joining us for our Fireside chat on digital health trends. My name is Alex Kasich. I write about operations for modern healthcare. I'm fortunate to be joined by Jason Gorovic, the Chief Executive Officer at Teladoc. Since taking the reins in 2009, Jason has helped grow the company to become a world leader in virtual care. I'm excited to hear what's in store for the rapidly expanding medium and how it will shape healthcare delivery. Thanks for joining me, Jason.
Alex, thanks for having me. I'm looking forward to the conversation.
Yeah, we're so happy to have you here. There's so much to talk about in this space. We've seen so much change when it comes to telehealth over the past year, how it's being used as a medium to bridge access gaps, new opportunities to pair it with emerging technologies to try to better expand care, and then as well as remote monitoring and a lot. I'm curious, just from your insight, how telehealth has evolved over the past year and what impacts you expect to have in the healthcare space.
Well, yeah, so that's a great place to start. Obviously, I've been at this for a long time now. I think it's 12 years now that I've been at Teladoc Health, and we've seen quite an evolution. I think the good news is it's always been our vision to be the destination for consumers, regardless of what their healthcare needs are, and a belief that you could deliver excellent and comprehensive healthcare in a comprehensive way virtually. And the last year has just accelerated that journey. I think it's created an inflection point in consumers' awareness and adoption to where we're far past those stages of the curve to where now it's about not only acceptance, but actually expectation. And the consumer is not just expecting that they're going to be able to get healthcare virtually, but they expect they're going to be able to get a comprehensive set, sort of full suite of services virtually, whether that's mental or physical, whether that's chronic or complex or acute, and that it's all going to have to work seamlessly with the healthcare system. And so, whether it's employers and health plans, and quite frankly, our conversations with those clients have just massively changed over the course of the last year. And that's one of maybe the most refreshing and surprising parts about this is that those conversations, and with hospitals as well, have become much more strategic, much more holistic, and much more integrated into their overall care and care management strategies. And I think there's no question that change is here to stay. And we're just on sort of a new level of acceleration that was already moving pretty quickly. So we're happy to be in the position where we can be there to help.
It was moving pretty quickly, but there was, a bit of a hesitancy when it comes to how effective the medium can be, and it seemed that COVID-19 has expedited that transformation. So I'm curious, when it comes to providers and patients' expectations going into this, how have you seen those evolve over time, and what they think that can be accomplished via telehealth, what they did before the pandemic versus now, and how it can be best be utilized.
Yeah, I think prior to the pandemic, we were still building awareness among consumers. We were still roughly 50% of the population was aware that telehealth was an option for them and that virtual care could take care of their needs, much less, how comprehensive, how broad is that suite of services or set of clinical capabilities. And there's no question that there were early adopters in the provider space, both among physicians and institutions, and yet there were plenty of laggards. I think all of that has massively changed to where everyone now knows that virtual care is an option for them, and they expect to be able to get care on their terms, right? Whether that's what's the modality of technology you're using, what's the breadth of clinical services, and most importantly, how integrated are those clinical services? Because people see themselves as just whole people. They don't see themselves as a single condition, whether mental or physical. They see themselves as needing great care. And now they realize they can get that virtually. Similarly, for providers, I mean, I hear across the spectrum that, physicians maybe say, okay, we could do urgent care virtually historically, and now their eyes have been opened to much more complex, much more intensive care, whether that's physician to physician consultations using technology, whether that's post-surgical care into the home so that the patient doesn't have to come back into the hospital for that post-surgical workup, or whether that's post-chemotherapy and really much more intensive and complex management of a patient in their own environment. It's significantly better for the consumer from an experience perspective, but it also delivers better outcomes because you're not making someone leave their own environment. And in this case, over the course of the last year plus, it was potentially exposing them to a condition when they're already in a frail state.
And yeah, it's interesting just in terms of, telehealth had this notion that it was mainly for low acuity care. And it seems to have evolved to one that could be manage, chronic conditions with the right remote monitoring technology. And I imagine that's where your deal with Livongo will come into play and help address that space. But I'm curious what you think it can be accomplished, particularly when it comes to those who are struggling with the chronic condition, and how telehealth can fill care gaps and increase and improve outcomes.
Yeah, well, that's exactly the manifestation and sort of next giant step forward in our view of taking care of the whole person. And we have obviously been on that journey for a long time. When we introduced mental health care, that was getting to longitudinal care for a person who lives with a mental illness and has to deal with that, not just episodically, but really every day, and is on a journey to better mental health care with the right resources wrapped around them and brought to them on their terms. There's no question that Livongo made massive breakthroughs in terms of helping people who live with chronic conditions, whether that's diabetes or hypertension or mental health issues, whether they're pre-diabetic and trying to keep from becoming more severely ill, and that many of the times people who live with those conditions have multiple comorbid conditions. And Livongo really harnessed technology with great, highly user-friendly devices combined with amazing data science to be able to really change consumer behavior and deliver better health outcomes. When you put that together with the complex care as well as episodic and mental health care that Teladoc was already delivering, in addition to things like our registered dietitians and nutrition programs, then you get to really comprehensive care. And that's critical because someone who's living with diabetes doesn't just think of themselves as a diabetic. They think of themselves as a person with multiple needs and multiple conditions that need to be taken care of. And that gets us to where we can really reimagine how primary care is delivered, reimagine what primary care is and how a consumer experiences healthcare, and really move the needle on both cost of care as well as the care experience.
We're seeing, hospital at home models take shape, and other types of infusions and other home-based deliveries. I imagine this could be accretive to, what Teladoc is trying to accomplish, and just trying to broaden the suite of services that are available. Another element I've heard from other, executives are that when you get a view of a person's home and you see where they're living, their support system, what type of food they have access to, it broadens the context here. And to your point about wrapping around, a holistic care and caring for all the needs of a person, I imagine, this gives you another insight into how to combat, some of these issues that are struggling, that are beyond, just health. You're dealing with food and nutrition and transportation and all the others.
Yeah, no, that's exactly right, Alex. One of the biggest surprises for me after we closed the Livongo transaction was how rapidly our hospital and health system clients came to us saying they wanted to take advantage of the technology and the capabilities that Livongo has. You know, when someone's discharged from the hospital's still on the hook, right? They're on the hook for readmissions. They're frequently in a risk arrangement where they're taking either bundled payments or capitation, or they're in a ACO or risk arrangement with the payer. You know, they really want to make sure the person gets the best care in the most efficient manner, and frequently discharging them with a connected scale or a connected blood pressure cuff or a connected blood glucose monitor is really the key to doing that. And so then when you pair that with the data science behind those devices and the fact that we're collecting 2 million blood glucose measures a week and can apply data science against that to deliver really personalized health nudges, and then loop in a physician in a video encounter with the consumer in the event that they really need to be seen in person, that takes hospital at home to a whole new level. It takes readmission avoidance to a whole new level, and it aligns with what the consumers want anyway. So, you know, this is just it's a rare circumstance where better medicine, lower cost, and a better consumer experience all go hand in hand and result from the same technology and the same interventions.
With all that data coming in, is that hard to operationalize where you have all these different data points from your patients? I'm curious how that goes into the workflow and how that's disseminated amongst the care team, and how, you know, what benchmarks are used to trigger certain types of interventions. How does that all work?
Well, you're pointing out one of the biggest problems in healthcare, right? It's too much data and not enough insight, right? Not enough actionable insights that are derived from that data. And that's where the magic of real data science and the depth of expertise that we have comes into play. Because when you combine, you know, 13 million virtual visits and all the data that goes with that, with all of those vitals that we're getting, whether that's weekly weight or weekly blood pressure or daily blood glucose measures, and then you combine it with external data sources like how many steps are you taking and how many flights of stairs do you climb a day, and how much sleep did you get and what are you eating? Well, now you've got just a massive amount of data that if you don't have the right data science behind it, that can ingest that data and make sense of it and then deliver personalized insights both to the healthcare consumer as well as to their physician or their coach or their registered dietitian or their therapist, then you just have data overload. But if you can harness that and deliver really personalized insights that are unique to that consumer, to that patient, well, now you've got really, really powerful healthcare, and that can only be done in a virtual environment.
On the mental health front, as we talk about treating the whole patient, what strides have you seen telehealth make when it comes to ensuring all folks have access to, therapy and other types of mental health services? It sounds like there's been major inroads there. I'm curious what you expect the long-term impacts to be as potentially more folks seek those types of services via telehealth.
Yeah, I think there are really three major breakthroughs in mental health care when it comes to virtual care. One, as you say, is just massively expanding access. You know, this is an area where virtual care truly is the great equalizer because we have so many underserved communities where there are no therapists, there are no psychiatrists, and yet we can bring those resources to bear for the consumer virtually because we break down those geographic barriers and those borders and those challenges in certain communities. The second one is breaking down the stigma, because virtual care is much more sort of personally accessible, right? You're likely to ask a colleague, hey, do you like your pediatrician? Would you recommend them? But you're probably not as likely to say that about a therapist or a psychiatrist because of those issues of stigma. Well, in a virtual environment, we can connect you with the right therapist. We can do it in a way that's non-judgmental and even somewhat anonymous for you. And you don't have to, park your car in front of the therapist's office, which in many communities is still stigmatized. And that's a terrible thing, but it's a reality. And this helps us get past that stigma. And then the third thing is really bringing the right resources to bear for the consumer based on their personal and individualized need. And we really think about that as a stepped care model where we're bringing technology resources to bear, whether that's digital cognitive behavioral therapy or dialectical behavioral therapy modules, combined with a social worker or a psychologist and a psychiatrist who can do medication management for you, all in a team and stepped approach. And that's really the hallmark of our just recently announced My Strength Complete launch. My Strength Complete takes the best assets of Livongo and Teladoc and brings them together into that really sort of full credit answer for mental health care. And then the next step, of course, is incorporating that with virtual physical health care to provide whole person care. And that is really the holy grail where, going back to your question about managing chronic conditions, if you have untreated either anxiety or depression, you are much less likely to be compliant in managing your own hypertension, in eating right, in exercising enough, which all have terribly exacerbating effects on people who are living with diabetes. And so all of those things go hand in hand, because if you treat someone for what they're feeling emotionally and mentally, you're much more likely to be able to effectively treat them for what they're dealing with physically.
Are there hurdles when it comes to finding the right help, when it comes to, sourcing therapists or, other types of folks to fill these access gaps? Do you find obstacles in trying to ensure that you have, the right type of staff to ensure that most folks are getting the care they need? And I'm curious, since you're a global company too, how site of service plays into all this. With the different regulations around where a patient versus a provider can be when delivering these services.
Well, this is really where we have the benefit of scale, right? Scale really matters in being able to attract talent, being able to attract ample supply on the supply side of the supply and demand equation, which translates to enough physicians, enough therapists, enough registered dietitians, enough coaches, enough specialists. And the reason that we're able to do that is because we have so much on the demand side, right? This is truly an example of where scale gives you the benefit of the network effect, where more demand drives more supply, because when the physicians or therapists or other providers come onto the platform, they know that there is going to be predictable demand for them. And that's ultimately what they're looking for, because if they're going to dedicate their time, they want to know that they can help people, that they can be active, that they can make a difference. It also gives us the ability to have mixed staffing models where we're able to, in some cases, hire physicians because we have adequate demand, that we can do that in an economically viable manner that delivers high levels of quality, great customer experience, as well as, sort of take advantage of having employed physicians who are deeply engaged with the rest of our programs. So there is no question that scale benefits us. And you're exactly right. We're seeing the same thing outside the US as we are in the US in terms of momentum. In fact, I would say all parts of our business are seeing broad-based momentum, both in the US as well as outside the US. And I think that's evident by the volume increases that we've seen. If you look at our visit volume in the first quarter, it was up 69% year over year, in spite of the fact that we had 90% fewer flu visits, right? Because social distancing doesn't just work for COVID, it works for flu and strep throat and all the other things we would normally be seeing at this time of year.
You mentioned, with hospitals, taking on more risk at times, or providers in general, whether it's readmissions or other, bundled contract arrangements. I'm curious what you think the intersection between value-based care and telehealth is. And I know there's some, payment parity laws when it comes to fee-for-service in the trying to level the payments between in-person and virtual care, but when it comes to the intersection between value-based care and telehealth, how do you think those interplay?
Yeah, so along with the increase in sort of strategic conversations with our clients is coming the increase in discussions around value-based care and new payment models that include risk sharing, upside gain on share of savings, as well as ultimately, I expect us to be, taking population risk because I'm so confident that we can make a giant impact on the healthcare outcomes as well as the cost of care. And that's good for the whole system, right? That's good for the payers. It's good for the consumer because they're getting better outcomes at ultimately a lower cost. And of course, it's great for us because we get to share in the upside that we create. So there is no doubt in my mind that we are rapidly going there. We're starting to do that. I frequently talk about doing that in a stepped fashion where we start by doing it on a specific population, with a specific condition, and ultimately guaranteeing the savings that we generate, and then moving along the continuum toward more risk-based arrangements, and ultimately something that probably looks like a limited or a primary care capitation.
I'm curious just if you think this momentum, given all the elements we've discussed, that's pushing care toward people's homes and through virtual visits. Do you think that's sustainable? There's so many different factors at play. Just we've talked about provider and patient preference, reimbursement, site of service, all these different regulatory elements come into play too as well. But I'm just wondering, in terms of the long-term sustainability of the medium as a pretty consistent source of how you get your care, where do you see the future there?
Yeah, there is no doubt in my mind. The genie's not going back in the bottle on this. Consumers have net promoter scores in the mid 60s when it comes to virtual care. Physicians are actually experiencing the same thing where they have realized that this is just fundamentally a part of the delivery model and it's here to stay. And so, I talked to CEOs of leading specialty care institutions who are saying 40 to 50% of their visits they expect will be virtual on a long-term basis. And so, that's why I'm bullish on the technology side of our business that provides platform services and technology platforms that facilitate the delivery of that care for hospitals and health systems. But it's also why I am absolutely certain that the momentum will continue and we will continue to see the demand for more comprehensive whole person virtual care solutions. And it's why I've never been more confident about where we are, our position in the market, and what our future looks like.
Great. Well, let's get a couple questions from the audience. One of which is from Amanda, asking your opinion about patients with chronic conditions using apps like Livongo who may be falling off of the digital cliff. Do you envision the need for investing again in the human connection of care or coordinators and managers with their patients to ensure that you have that physical connection combined with that virtual one to best address their needs?
Yeah, well, I think that's a great question, Amanda. What we, and this has always been part of both our philosophy historically at Teladoc Health, and was even before Livongo became part of the family, that you want to supplement the digital interaction with human interaction where it's appropriate and where it's necessary and where the consumer could benefit from it. And so that's why we pair not only digital nudges that come out of that data science, but also with a coach, a human coach. And we've got a great team of coaches who reach out to the consumer and work with them on a regular basis on, what's your eating plan? What's your exercise plan? If we've seen a few different readings in your blood sugars, or you haven't taken your blood sugar readings in a few days, what's going on, and can we help you? But it's also where we can bring now a physician to bear for that same consumer. We can bring a therapist to bear to say, hey, is there something else going on in your life? As opposed to historically, it was just, the doctor would check in with you occasionally, but most of the time you had to go to the doctor's office in order to get care. And, there's no greater barrier to getting care than actually having to make an appointment, wait a few weeks, get yourself into the doctor's office because you're taking time off of work, you're trying to figure out childcare. This is a way that it is just part of your life. And look, consumers want this about all parts of their life. It's not unique to healthcare. I would say healthcare has lagged. We've been building for this inflection point for a long time. It's always been part of our vision. And so we're happy that we're ready when that inflection point hits to be there for consumers.
Do you think there's an inherent conflict between those that are expanding, their acute space and beds versus this push to try to drive care outside of the hospital? I'm just wondering how that resolves itself, where, you're going to have some that are steeped in the traditional way of delivering care versus, some of the consumer preference and the flexibility that it provides both to consumers and providers. I'm wondering, how do you think that resolves itself when you come to those like conflicting areas of thought?
Yeah, I'd say a few things on that front. First of all, I just want to be clear, healthcare isn't an either or thing, right? This will be an and, where people will get care virtually. I believe that Teladoc Health will be their first stop on a healthcare journey. Virtual care will be their entry point into many of their sort of healthcare situations. And in some cases, they'll have to be referred for in-person care. And part of what we have to do is make sure that it's a seamless, frictionless experience for them as we refer them into a care setting to get in-person care. So I think there are a lot of partnerships likely in our future that will make sure that we sort of execute on that flawlessly for consumers. Having said that, most of the hospital CEOs I talk to are talking about how they can streamline their operations. They're recognizing that a lot of care will be delivered virtually in the future and that they may not need as much physical space. So I think what you're going to see is they are looking to optimize the use of their square footage, the use of their physical space to deliver the highest value services that really need to be delivered in person. And they're going to incorporate a lot of virtual care along with it.
Got it. Thank you. We got another question from David. Thanks for sending this in. How do we ensure telehealth services are accessible to the underinsured or uninsured?
Yeah, so this is always a big challenge, right? I would say both for the underinsured and the uninsured, virtual care does provide a less expensive alternative, right? A more cost-effective alternative. And over the course of the last couple of years, we've continuously expanded the scope and the penetration of our direct-to-consumer offerings when people are self-pay, right? They don't necessarily have an insurer behind them. We also are seeing the proliferation of uninsured or underinsured populations who are employed receiving our benefits from their employers, whether those are seasonal employees or part-time employees. In many cases, the large employers are extending the Teladoc Health services to that population because they know it's better for that population and it's better for their businesses, right? It's better for their businesses if those people stay healthy and stay at work as opposed to being out of work and because they've had some sort of an exacerbation or an illness that is unmanaged. So, we're working hard at that. We also work with a lot of, obviously these are insured populations, but we work with a lot of managed Medicaid populations in order to sort of bridge the access to care issues that many of those populations experience. And that's across our entire suite of products and services, both mental as well as physical healthcare.
You mentioned employers. I imagine, a big push for telehealth services is coming from them, where, they're trying to look at some of the lowest cost options, for their employee base as they try to hamper down healthcare costs for their employees. So I imagine you'll see, you've seen some just plans tailored, benefit plans tailored to, telehealth services when it comes to these employers.
Yeah, it's a super interesting area. And I've actually been impressed with how many large employers are talking to us about our Primary 360 product, which is our virtual primary care offering that brings together really all of our resources, and then in many cases pairing it together with a virtual first plan design, right? A plan design that has richer benefits if your first stop into a healthcare journey is a virtual stop, because we know that in a virtual environment, not only can we deliver care more efficiently, but we can also help to get you to the right destination if you need to be seen in person the first time without going through many sort of dead ends along the way. And that's good for the employer, it's good for the employee, and it's good for the overall system. So we're seeing a lot of demand, and both of those are seeing demand. Sometimes they're seeing demand together, and sometimes it's one or the other.
Yeah, and I'm wondering, just in terms of the oh, actually, we have another question that came in from David. I'm wondering, he's wondering whether you're partnering with large healthcare organization. I know we've addressed this somewhat, but I imagine, some are interested in specifically using like the internal aspects of the business model for their healthcare system. I imagine there's some proprietary things with the EHR they can integrate. But if you wanted to get into some of that with your health system partnerships.
Yeah, so definitely. We bring a whole suite of virtual care technology assets to our hospital and health plan, our hospital and health system clients, and that can be really narrow, like they want to do a telestroke program and take care of our technology to do that. It can be really broad. They want to virtualize all of their departments and clinical service offerings. It can be specific, like they want to launch their own virtual primary care and they're looking for our technology resources to stand that up on. And it can also be in partnership where they don't have a primary care offering. They'd like us to stand up a virtual primary care offering in front of their hospital. And then for those people who need to be referred in to see a specialist, we refer them in to them. In many cases, most cases, that's a branded offering. That's their brand in front. So the consumer knows from the beginning that they're engaging with that hospital system. I think the other part that's sort of unique and valuable that we bring is our clinical resources are sort of modular and optional. So if a hospital says, well, I want to take advantage of your network of psychologists and social workers and maybe your psychiatrist, but we have our own primary care physicians, so we're going to use our own. We say that's fine. We can just modulate it depending on what you're looking for.
And I wanted to touch on the virtual first plans. I've seen some health plans offering, more specific, just virtual first plans to their members. There has been some concern just about redundancy. If you're layering some of these telehealth services that are almost always going to lead to some sort of in-person care, and then you're just adding extra steps in between. I'm curious what your thoughts are on how we streamline care without adding additional steps or cost.
Yeah, so that hasn't been our experience. About 90% of the people who come to us get their needs met the first time and don't need to be referred into a physical environment. In a primary care relationship, that may be a little bit more than 10%, but it doesn't bubble up above 40 or 50%. We're also doing a tremendous amount of first diagnosis of things like hypertension and diabetes, or identifying pre-diabetic patients, which probably would have gotten missed if you didn't have a virtual first environment or something that encourages a sort of convenient and low friction way to enter into the healthcare system. So, we actually don't see a proliferation of additional sort of utilization that wouldn't otherwise happen. And in some cases, it's better that it happens, right? It's, if someone is experiencing, certain conditions and they really need to be seen now, we want to make sure that we're getting them into the emergency department or into see a specialist tomorrow rather than waiting for it to linger for a few weeks and potentially get much worse.
Yeah, to your point, I mean, always costs something to get someone into the healthcare system. So I imagine that act in itself has a lot of value, no matter like what the downstream care is.
Yeah,
Um,
Alex, I remember many, many years ago, shortly after I started at Teladoc Health, and I got a letter from a mother of a 12-year-old boy who the mom had reached out to us because the boy was experiencing some symptoms, numbness in his legs and some challenges. And our physician spent 45 minutes with that mom talking to her about some of the concerns that that physician had, that this could be something that looks like MS. And MS is really rare in children. And because it's so rare, it's frequently missed for a matter of months or even years with misdiagnosis. And so that doctor coached the mom on what to ask in the emergency department when they went into the emergency department and what tests needed to be run. And sure enough, that ED was just about to miss it when the mom started asking these questions. And the mother was frightened that the child had a diagnosis of MS, but incredibly grateful that our physician had taken the time to educate her and help make sure that that didn't get missed for months or years, and have that patient, that mom with that child, cycling through the healthcare system without getting a resolution. So sometimes a subsequent physical visit is actually a really great thing.
we got another interesting question that's been on my mind from Sandra Van Treese too. She asked you, Jason, what your advocacy efforts are focused on. We mentioned some of these waivers are in place during the emergency declaration. And do you think those waivers will become permanent or will they expire? What are the implications if they do expire? I know it's pretty broad in terms of the waivers and like expanding the breadth of services that are covered, some of the, HIPAA related ones I think we've talked about prior, but yeah, if you wanted to go into that.
Right. That is a broad question, but an important one. I think the site of care waivers are here to stay. I don't think that there's any question about that. I think reimbursement will continue to be broad-based for virtual care, although I'm not sure that it will be at the same level. In fact, I'm not sure it should be at the same level. Virtual care is fundamentally more efficient. And we should reflect that in the reimbursement rates that are matched with it. I don't think there's any scenario in which the sort of suspension of HIPAA enforcement continues beyond this situation, and I don't think it should. I think HIPAA should go back to being enforced. I think it's important not only for the actual data privacy, but also for the consumer trust in the system. And I think that's absolutely critical. I think, quite frankly, we're likely to go the other way and continue to get more regulation around data privacy as that continues to be a bigger and bigger focus. With respect to the state licensure rules, my guess is most of the states will go back to individual state licensure. You may get more reciprocity across state lines. I think the one big question is, will we get, and this is only really necessary in a national emergency, but I do wonder whether we're going to get the federal government having the right and the authority to suspend the state licensure requirements in the event of a national emergency. That certainly would have been helpful back in March and April and even May of 2020. I think that's still a big question mark given the various constituents on that question.
The compact would have an effect there, just in terms of the nurses and physicians to some extent, the ones that do participate.
We'll see. Yes, we'll see if that really gets traction and participation across a wide swath of states. I'm hopeful. I think that would be great. I'm just not really willing to bet on that one at this point.
Sure, understood. We got about 5 minutes left, so if anyone else has any other questions, please do send them in. I wanted to get to one just in terms of next steps for Teledoc. What you're building on now, what you're excited to expand, where you see the company going.
Yeah, we'll continue to expand the scope of our clinical services. Most recently we launched a chronic kidney disease program as our next chronic care management program. Obviously, that leverages on our diabetes management, hypertension management capabilities, and it's on that cardiometabolic spectrum. It's also a big area of focus as an increasing component of the overall cost of care in the healthcare system. So we're excited about that. I think you'll see us continue to expand that clinical scope. Certainly, Primary 360 is front and center for us and for our clients. And I think over the course of 22 and 23, you'll really see that take off. And then, we're very excited about continued international expansion. Internationally, we've had great successes just recently in Spain, and as well as in Brazil with Telefónica, the big global telecom company in Brazil that operates under the Vivo brand, and that's a tremendous partnership for us. We've had recent successes in the Nordic region with Generali in Hong Kong. So we continue to see very exciting growth there. And we're excited to be able to lend a hand where we're needed. Like, we're working with hospitals in India right now to help bring expertise to that market where they're going through such a difficult time and overloaded with the COVID cases that they're seeing. And so we're happy to be able to help and do our part on the global scene and to really bring healthcare where it's most needed.
Yeah, that was going to be my next question. You answered it in terms of your role in addressing some of these international spikes. We have one other question from our own Aurora Aguilar. Data show that patients like telehealth, but they want to have more personalized care. So I'm wondering how you're ensuring that they get, this hands-on attention that while, still using these virtual care mediums.
Well, I think mental health is a perfect example of that, where a consumer and a therapist have a longitudinal relationship. It's frequently multimodal, where they're connecting and communicating via text, chat, phone, video, interchangeably over the course of time. I mean, think about that versus the traditional, hey, come and see me every 2 weeks, right? That is just so fundamentally different. And now that therapist can say, why don't you use this online module in between our sessions so that you can be working on your skills, and I'll review how you're doing, and then we'll talk about it when we talk next week. And by all means, text me, send me a note if you have questions or concerns in the interim, because people live with these things every day, all day, not just occasionally or once every few weeks. And Primary 360 is exactly the same. It's a care team. There's a primary care physician who has a relationship with the patient and vice versa, but it's leveraging all of your individual data. So, it's personalized to you based on how much exercise are you getting, how much are you sleeping, what are you doing, what other conditions are you dealing with, are you getting therapy, are you not getting therapy? And all of that is sort of wrapped around the consumer in just a much more personalized manner than, unfortunately, what most of our primary care experiences have devolved to.
Well, Jason, I can't thank you enough for being a part of this with us. I really enjoyed the conversation, and we can't thank you enough for sharing your insight with us, and we look forward to keeping track of what Teledoc has next.
Well, thanks, Alex. I appreciate it. Thanks for having me.
Awesome. Well, thank you to you both for such a fantastic presentation. Thanks to our audience for the questions.